Hello, this is Sherry Squires. I'm Dr. Squires. I'm your medical director, and I want to introduce you to something that we're going to be doing and trying over the next few weeks. Hoping to make this a permanent way to get news and information to clinical personnel. Your leadership team has been wanting to figure out a way that would be good to communicate things to you that are pertinent in a way that it's easy for you to get and hopefully meaningful and even more hopefully maybe a little bit of fun. So what we want to do is put out something approximately every week or so. As you can tell, we don't have an official studio. There is no hair or makeup crew, obviously. But we want to do something informal that you can just watch when you get a moment, and hopefully it'll help you. And above all, we want feedback about this because we want to know whether you think it's worthwhile, whether you think it could be done differently or better, and we want topics for you. We're going to call this, and this is my idea, we're going to call this HEMSI Punch, okay? Why punch? Well, a couple of things. When you think about punch, some people kind of think of the punch like that. So this is going to be something that you might hopefully go, wow, like a punch. Well, the other thing that punch is sometimes is a drink. And when you are going to be served a punch, you sort of never know what you're going to get. Are you going to get that fizzy green stuff that has ice cream in it and tastes really good and you'll go back for seconds? Or will it be like the canned Hawaiian punch that some people love and some people think this is too sweet? But hopefully it's a punch that has some good vitamin E stuff in it that you hopefully will benefit from, but it'll also have a little bit of sweetness and maybe make it a little more fun to tolerate, okay? And maybe want you to go back some more. So, Cindy had an idea too that punch also could stand for P, patient care, U, updates, N, news, C, clinical information, and H, help. Clever, huh? That's Cindy. She came up with that just on the spur of the moment. So anyway, this is your first HEMSI Punch video. So this first one is going to be something that Dee is going to talk to you about managing airways. We're going to get ideas for this, hopefully from you. We also have some things that we want to do short videos about that we think you need to hear about. And these may be, when you open it, you're really not going to know what to expect. Sometimes it might be a clinical pearl. It might be an informative little video about something coming up in the near future. Like I may have Dr. Lee talk to us about the Rocket City conference that's going to be coming up that will be very pertinent to EMS. So we'll have snippets that hopefully will benefit you, but please give us feedback. If you have feedback for us, email Cindy or text her or call her. Let her know topics that you would like us to cover. Let her know questions that you have. If you see anything that you think could have been done better or differently, let us know that too. We appreciate your feedback, and these things are being done hopefully for you. So give us feedback, let us know. And we will have input from me and my medical direction team. We have Dr. Will Young and Dr. Melissa Willett Caldwell. If you haven't already met her, she came to us a few months ago. She did a fellowship in EMS at UAB at the end of her residency. She did an extra year of that, and she has a background as emergency medicine personnel. She was in your shoes, so as was Dr. Young. So we have a great team that we're excited about trying to work with you and get information that you need. Thank you. Let us know how you feel about this.
Okay, so we are going to be discussing CPAP today. First, we're going to cover who should get it. So primarily, we're looking at CPAP for patients that have a really high workup breathing and who have low oxygen saturations that are refractory to our use of oxygen and albuterol and ipratropium as a nebulizer treatment. You want to ensure before you use CPAP that the patient doesn't have a pneumothorax, and you want to be careful that the patient isn't hypotensive. If you are planning to give magnesium and methylprednisolone, that's fine, but that should come after CPAP. CPAP is a higher priority intervention for us. You can still continue to nebulize albuterol and ipratropium once the CPAP device is attached also through the nebulizer port. There are 2 settings on the CPAP device that you may use. Either 5 centimeters of water, which is customarily where we would start for our asthma or COPD patients, and there's a 10 centimeter of water setting for our acute pulmonary edema patients. The kit does come with a large mask, but we do have medium masks in the supply room that you can get to be on your truck, and that may be necessary for some patients, but most patients will use the large mask. So to attach it, it does hook up to the DISS port, this port, on your oxygen regulator. It should not be attached to the flow meter on the regulator of the portable tank or in your truck. So always use the DISS port. You want to be careful when you attach it to make sure that you don't cross-thread it. Once you cross-thread this plastic adapter here, it's not going to work again in the future when you try to move it between this and your truck. All right. There'll be a little bit of leaking until you get it all the way hooked up. And once you get it all the way hooked up, it will be, of course, flowing. You put this patient, the patient will be wearing the mask with this attached, and you'll let them get comfortable before you strap it to their face. I'll take that off. One question that we commonly get is, why do we use CPAP instead of BiPAP? In the pre-hospital environment, there has not been shown to be a difference in outcomes, but it is a little bit of a cost savings for us to use CPAP devices. It's also a little bit simpler to operate. And one really important thing to understand is that both CPAP and BiPAP in the pre-hospital environment help prevent the need for intubations at a pretty high rate. So it's important that we do this intervention when it's indicated. And that's all for now. Thanks for tuning in. If you have any feedback, please let us know, and we'll have another video out to you shortly. Thanks.